Hi, everyone. My name is Renee Bro. Welcome to this first series of podcasts in the Advanced Patient Care Skills and Health Assessment course. This series of podcasts will be focusing on an overview of patient assessment. In this series of podcasts, I will be reviewing the patient care process with you and then explain the components of patient assessment, including medication history taking, the identification of drug therapy problems, and the development of a care plan. We will then also do a short review on documentation related to patient care. Ultimately, my goals are to help you relate the components of patient assessment and the patient care process to the cases that you'll be seeing throughout this program and within your own practices. This is a diagram that some of you may have seen before, particularly if you are a recent graduate from the BSc Pharm program here at the U of A. It illustrates the patient care process in terms of gathering of that information to help evaluate and complete your patient assessment, the development of the care plan, and implementation and follow-up monitoring. Generally, for the purpose of this course, for the most part, we will be focusing on the top section regarding patient assessment. So we will be reviewing in this lecture the steps to collect a medical history and medication history and the overall process of doing the drug therapy assessment. Patient and drug therapy assessment occurs as a result of the information we have obtained from the patient or caregivers in the form of a medical and medication history, and from laboratory tests and physical assessment information that may be required in order to complete our assessment. So why do we need to assess the patient? Regardless of the setting that you're working in or the purpose of why you are actually seeing the patient, we assess patients to help understand their needs and perspectives and preferences, ultimately to be able to make rational drug therapy decisions for patients and to determine if they are experiencing any drug-related issues or have any medication-related needs, and to work with the patient to resolve those issues. In terms of setting the stage, the process of patient assessment will be applied to the care you provide regardless of the setting you'll be working in, whether that's in a community pharmacy and you're assessing a patient for a minor illness or managing their chronic diseases, or whether you're working in a specialized ambulatory clinic or an acute care setting. The type of practice that you have will also help tailor the type of assessment that you'll do. So if you're in a very collaborative practice, you may need to conduct a very focused type of assessment because you know that other members of the team are helping to complete the rest of the assessment. This is compared to if you're working in a very independent practice and you're needing to do a more comprehensive assessment on the patients that you see. Also, you need to think about what the purpose of you seeing the patient is. Is it to conduct a very comprehensive assessment, or is it more of a focused assessment related to a specific medical condition or an already identified drug-related need? Then you also have to consider how much time you have to spend with the patient, as well as the urgency of the situation. We're going to first discuss the health and medication history. So there are some basic patient interviewing skills that are important when we are interacting with patients. First, it is preferable to make the environment as comfortable as possible for the individual you are interviewing, whether that be the patient or caregiver. Sometimes, however, there isn't a lot of flexibility in this depending on where you are practicing. For example, there is little flexibility in seating arrangements if you are interviewing a patient in their hospital room. In terms of questioning, you will likely need to use a combination of closed-ended and open-ended questions in order to obtain the information you require to make your assessment. Each type of question serves a purpose. For example, using open-ended questions helps the patient's perspective be told, but using closed-ended questions can be used to help focus the interview, gather more specific details, or clarify something the patient has already said. Some other techniques can be used to help with the verification of patient information. For example, clarification is useful if the patient has provided some confusing or conflicting information. Reflection occurs when you are reflecting the patient's words or feelings back to them to verify what they've said and to illustrate empathy and understanding. Facilitation actually encourages the patient to continue communication, and this can be done through a verbal or nonverbal indication. Sometimes silence can be used to help give the patient time to think or organize thoughts. And finally, using summary techniques to help verbalize your understanding information that the patient has given you. It is also important to remember that the nonverbal skills are essential in conducting patient interviews. These are reviewed in your textbook readings. There are some things when interviewing patients that we should try to avoid. Changing the subject too quickly doesn't allow the patient to tell the complete story and can damage rapport with the patient. This does, of course, need to be balanced with the need to keep the interview on track and prevent the interview from going off on a tangent and completing the interview in a timely fashion. Pharmacists are notorious for providing information during patient interviews, and sometimes it can seem like we are passing judgment if it comes across that we are giving our own personal opinion too much. There is a time and a place for providing patients with information and advice, and it should be done after or near the end of the interview to allow you as the clinician to obtain all the information you require and to allow the patient to tell their story and feel heard. Giving false reassurance can be inappropriate at times, especially if the patients have a serious or terminal illness. We need to avoid the temptation to tell the patient that everything is going to be all right, even though that may make us feel better. Asking leading or biased questions can alter the information received from the patient, and this may not necessarily be accurate information. Finally, using professional terminology too much can sometimes overwhelm or confuse patients. So we need to have an understanding of the patient's education level and use lay language where appropriate that will help them understand the language in day-to-day life. The health history comprises the following information, and we will discuss each in a bit more detail on the following slides. The chief complaint is the brief statement as to why the patient is seeking care. Sometimes this can be obvious depending on the particular situation, but if you are seeing a patient in a general practice setting like your community pharmacy, it may take a bit of digging to determine what this actually is. There is sometimes no chief complaint per se, but a general purpose to the interview or assessment. So, for example, the patient may be seen for general follow-up with regards to their diabetes management. The history of present illness then goes on to provide more detailed information on the chief complaint, including any specific characteristics of symptoms, such as those listed here. The past medical history could include other comorbid conditions, past hospitalizations or surgical procedures if applicable, and it might also be relevant to include accidents or injuries and obstetrical history. The family history is the brief picture of the presence or absence of illness in first-degree relatives and is also important information to gather. In most cases, it is only important to include information on first-degree relatives. The social history is also a common component of information gathered in the medical history. It is also important to clarify or quantify the amount of tobacco or alcohol use. For example, being a social drinker is not very specific and may mean something different to you as a clinician compared to what it means to the patient. So it's important to get a specific information on what the actual amount of alcohol use is on that patient. The review of systems is a general description of patient symptoms, usually done in a head-to-toe format. The purpose is to identify any potential symptoms, conditions, or disease states not yet revealed by the patient during their chief complaint, history of present illness, or past medical history. Many of you are quite familiar with gathering a medication history, so I will just briefly go over the important components. Current prescription medications can be obtained by performing a best possible medication history, including prescribed dosing versus actual dosing schedule. You should also try to quantify the amount of PRN dosages a patient may be taking. Similarly, as with prescription medications, it is important that the information we collect for non-prescription medication is accurate, including quantifying PRN dosages and also information about any herbal or alternative medicines the patient may be taking. Sometimes it's important to gather information about past medication use and how it has worked or not worked for the patient, how they have tolerated it, or were there any adverse reactions or allergies to be made aware of. This may be of particular importance in someone with a long-standing medical condition to get a sense of what medications they've tried in the past and the reason for discontinuing those medications. Other information that's important to collect include information on allergies, prior adverse drug reactions, and previous immunizations as well. Medication adherence can also be assessed. Now that you have completed the medical and medication history, there are other pieces of information that need to be considered in order to complete your patient assessment. Incorporating physical findings into your overall patient assessment is important not only to identify new drug therapy problems, but in the ongoing monitoring of efficacy and safety of medications. Some physical assessment findings may be documented by other team members already, while some components may be completed by yourself. The focus should be on relevant physical findings that aid in the identification of drug therapy problems and the assessment of medication for effectiveness or side effects. So why should pharmacists learn physical assessment? Learning basic physical assessment skills is important so that as members of the healthcare team, we can understand a common language among clinicians. It would also help you make prescribing decisions, monitor the effectiveness of drugs, as well as to assess for side effects. It would also help you communicate with other healthcare professionals, your own assessment and interpretation of findings, whether these are assessments you could perform yourself or were able to obtain from other sources, such as in a chart note. Similarly, it is also important to incorporate laboratory and other diagnostic findings into your assessment. Again, this would be to help guide decision-making and to monitor the efficacy and toxicity of drug therapy.